Parkinson's Awareness Month. While advancements in treatments have been made, we have yet to find a cure for the debilitating disease. Well, this morning, Dr. Katherine Wong is an assistant professor of neurology at USC, and Dr. Megan Gomez is from the Parkinson's Foundation. They are here to discuss the latest improvements for patients, as well as the push for research funding. Good morning, doctors. Thank you for being here.
Thanks for having us.
Yeah, such an important topic to talk about. Dr. Wong, let's start with you. Can you talk about the impact of Parkinson's disease on not only the patient, but their families as well, and the risk factors people should be aware of?
Absolutely. So Parkinson's is a progressive neurodegenerative disease that involves the loss of dopamine neurons. This leads to a set of symptoms that we call motor symptoms and non-motor symptoms. So the most common are tremor, stiffness, trouble walking. Those are the motor symptoms, as well as non-motor like mood, sleep, and thinking issues. Unfortunately, this disease affects about 1 million people in the United States and 10 million people worldwide. And it's progressive. It gets worse as time goes on, which leads to a lot of disability for the patient with Parkinson's, as well as needing a lot of help from their care partners. Common risk factors are, we actually don't really know all the risk factors. So we think it's a combination of genes and the environment, with about 10 to 15% of Parkinson's explained by genes, but the rest coming from a variety of environmental exposures and also just age that we can't avoid. Those environmental exposures are things like repeated head injuries or exposure to pesticides.
All good information. Also, Dr. Wong, we've made advancements in helping the symptoms of Parkinson's, but of course, no cure yet. Can you talk about the best treatments at this point for the disease?
Sure. So the best treatments we have still are our classic treatment called levodopa, which is a medicine that once it's taken into the bloodstream and gets up to the brain, it turns into the active form of dopamine, which is what is low in a Parkinson's disease brain. So our brain is able to use that medicine just like the dopamine that we normally make ourselves. And that's why it is still the gold standard and the most effective symptomatic treatment after all these years. We have come a long way in terms of developing new ways to get it in people, different kinds of pills, different kinds of delivery, but we still don't have a treatment, a disease-modifying treatment that will stop or slow the disease. That's where research and other exciting clinical trials come in, and we're really looking forward to stem cells and antibodies to try and actually change the course of the disease.
Dr. Gomez, Dr. Wong just touched on it. There's still a ways to go, obviously. You're here to talk about research funding. It is needed so that we can find a cure, right? What is the Parkinson's Foundation doing to make this all happen?
Yes, so the Parkinson's Foundation has 3 pillars. The first being funding research, the second being clinical care, and the third being education and empowerment for people living with Parkinson's and their family caregivers. In terms of research, the Parkinson's Foundation funds innovative researchers. We have a genetic study, there's community grants, so there's really all facets of research that we're tapping into to try to find a cure for Parkinson's and also to try to improve the quality of life for people living with Parkinson's.
And before we let you go, Dr. Gomez, I feel it's important for people out there who want to get involved. Can you tell us how we can get involved in advocacy?
Yeah, I think it can really be a grassroots effort, starting by just telling people what Parkinson's is, reaching out to your local representatives and advocating that Parkinson's be brought to the forefront. We just last week had 50 advocates from the state of California go to the Capitol to try to advocate for the Senate bill 895 to try to increase research funds for scientists. So every effort that you can to bring awareness to Parkinson's, especially this month.
The power to vote.
Yes.
All right. Dr. Gomez, Dr. Wong, thank you both for all the work you do and for sharing information with the public.
Thank you so much.
All right.